If you're paying attention to all of the COVID-19 talk, you might be hearing a whole lot of medical terms that can be kind of confusing. So what does it mean to have a positive screening? How is that different from a positive test? Peninsula Regional Medical Center is working to clear up that confusion as we hear from Delmarva Live's Katie Zarilli.
Jimmy, there's a big difference between a positive screen for COVID-19 and a positive test, and folks knowing the difference is going to be crucial. We're here with Dr. Charles Sylvia, PRMC's Chief Medical Officer. Thanks so much for taking the time out to talk with us today. I'm sure you guys are busy. So tell us what that difference is.
So screening is a series of questions to try to find out if you are at risk or not for having the virus, as opposed to testing, which is actually getting a sample from you and sending it to a lab to get the test result to see if the virus is actually in your system or not.
So what happens if somebody comes in for a screening and gets a positive screen?
Well, it depends. If they have been exposed to a person that is known to have the coronavirus, or if they are sick themselves, then that would make us think about doing a test. It doesn't guarantee that you'll get a test. A lot of it depends on how sick you are. People who have a fever or just mild symptoms at this point would not be tested, would be sent home to self-isolate and to wait it out. If you have trouble breathing, then we would want to test you to make sure that you don't get worse and possibly even admit you to the hospital for that.
Yeah. How does somebody know when to come in for a screen?
Well, everybody is afraid. Again, the best way is to call your family physician to ask what they should do, not go into the office, but to call and see if your symptoms or your potential exposure is worthy of getting checked. And then you would be directed to a place to get the actual tests and screening.
And of course, a lot of people are on edge right now.
Right.
Somebody might see what's set up outside that white tent and think, what does that mean?
Right.
I want you to help kind of clear that up.
So lots of hospitals are setting up tents outside of their emergency room as a screening tool to bring people in, to screen them without bringing them actually into the building, because we don't want to spread the virus into the building, into other susceptible people, like an emergency room, waiting room, which could be very full, and we just don't want somebody to go in there and spread the virus. So we do the screening first, and then we can actually do the sampling, and like I say, if you're not really sick, then we'll send you home and let you know the test result, and it may take several days to get a report back on that.
Any other misconceptions that people have that you wanted to kind of just get out there?
The majority of people that do get infected have mild disease and will recover just fine. It may take a week or two. Again, only a small minority of people get really sick, and that's again the people who are elderly or who have underlying medical problems like diabetes and heart disease. Those are the people that we really worry about. Those are the people that need to stay away from other people and to not get exposed out in the crowds, because those people have more trouble dealing with the virus.
Sure. Dr. Sylvia, thank you so much for taking the time out to kind of just let us know more. The more we know, I think the better we feel.
Thank you very much.
Thank you so much. All right, Jimmy?
And as you can imagine, the team at PRMC is working around the clock to stay on top of COVID-19 information that seems to change every second. Of course, we're going to share with you all the pertinent information as it comes available.